what are the fellowship programs across various centers in the country which are offering ROP fellowship. So I have no financial disclosures. So as we know that there is increasing number of neonatal ICUs with poor neonatal care, which is causing increase in the number of babies who are presenting with severe ROP, which is sight-threatening. Based on the study which was done in 2016, 32.4% of outborn babies who were referred for ROP had stage 5 on presentation. 89% of newborns who were referred to this tertiary care center had never got screened for ROP. And most of these patients who were referred to the center were picked up by the parents, who noted that the child was not seeing. Ophthalmologists referred only about 25%, and none of the patients were referred by a pediatrician. We are all well aware of the screening guidelines, which we follow as per the RBSK and National Neonatology Forum. So in India, we are screening babies who are less than 34 weeks of gestational age or who are less than 2 kilograms. This is to broaden the spectrum of babies who are screened, and the babies who are having risk factors, those between 34 to 36 weeks, they are screened within 25 to 30 days of life. International guidelines are different. This is how a baby who comes to us with stage 5 ROP would present with leukocoria, and that is a stage when most of us may not be able to do much for these babies. The management guidelines are based on the ET ROP group, wherein zone 1 all stages have to be treated, and babies who present with zone 2 disease, the ones with stage 2 and 3 with plus disease, they need treatment. Rest all babies need to be followed up. We have various management options which range from anti-VEGF, lasers to surgery. Now the question comes, who is going to perform these laser surgery? So there are various ROP fellowships which are being delivered at various centers across the country. Pediatric VR as a specialty is mostly a part of long-term and short-term VR fellowship. So I went ahead and proceeded at the AOS website, where I saw these are the various centers who are offering these fellowship programs, and then I shortlisted the centers who are offering pediatric VR fellowships. So I approached the designated concerned persons whose details were available on the website. I took feedback from the fellows and colleagues, and then I came up with this chart where we can see what kind of fellowship is being offered. So at RP Center AIMS, there are two or more senior residents who are for a short posting for up to 3 years. They perform about 100 lasers or 30 anti-VEGF injections. And the ones who are for long term, who are dedicatedly posted in the retina specialty, they perform about 300 lasers and more than 50 anti-VEGF injections. But surgeries are not being given to the senior residents. At PGI Chandigarh, it's a part of a 3-year VR training program. So these trainees, they perform about 200 lasers and anti-VEGF injections combined. Surgeries are only given in the last 6 months, and that is from about maximum of 3 surgeries, and that depends on the primary surgeon's confidence. At Arvind Eye Care Center, the specialty fellowship is the adult and surgical pediatric retina cases, and the surgical pediatric retina cases are mostly ROP. So at the Arvind Eye Care website, you can see that there's this dedicated surgical pediatric fellowship program that is for 1 year, and that is only for the fellows who have done 2 years of comprehensive VR fellowship. So, at Arvind Eye Care Center, even the clinical courses are offered for short term, that is for about 1 month, and that is basically focused on ROP and pediatric retina disorders. These are paid courses, and all of us can see it on the website. At LVPI, I contacted Dr. Subhadra, and a surgical training in ROP and pediatric retina is for 6 months. That is as a part of special course which is offered to serious applicants only. And all fellows are taught for 3 months, and more intensely to the faculty and the ones who are outside applicants, they are trained for 6 months. They are offered lasers and anti-VEGF injections, and surgeries are only given to the applicants who are dedicated to ROP management. At Shankara Eye Foundation, there is no specific dedicated ROP fellowship program, and it's a part of comprehensive VR training. There is no surgery which is offered. At Netralayam, Kolkata, surgeries are not offered, are offered very less, at about 1 or 2, but they are mostly performing lasers and lasers. At Sushruta Eye Foundation, Kolkata, ROP screening and lasers are being done, surgeries are nil. So MGM Eye Institute at Raipur has a dedicated 3-month ROP fellowship program. So they have 30 sessions where they screen babies for ROP, and 200 babies are screened hands-on by these fellows. The ROP lasers and anti-VEGFs are only observation. 4 to 5 lasers they observe, and 15 to 20 anti-VEGF injections. At IQ Super Speciality Hospital, there is no dedicated ROP fellowship program. It's a part of the 2-year comprehensive VR fellowship course. Surgeries are nil, and same is the case with Center for Sight, where no surgeries are offered to these fellows, and ROP is a part of short-term medical retina and long-term VR fellowship program. So I would want to conclude that tertiary cares of centers in India have been on forefront of managing ROP associated blindness. So there's a need that these centers come together and are supported by funds so that neonatal eye health training, screening, prevention and treatment can be integrated into newborn critical care program. So ROP is a emerging and evolving challenge. There are limited numbers of centers who are dedicated to ROP screening and management. In the era of anti-VEGFs, we should there's a definite risk of non-judicious use, over treatment, and untrained should never perform these injections, because then we have seen patients coming next day with total cataracts, RDs, and we should not hurry to laser also these babies. We should be very sure at this stage whether we want to inject or laser, and early surgery is reserved for selected cases. So I still feel there is very much shortage of the fellowship programs which are being conducted for ROP, and it should be a separate program in dedicated centers. Thank you.
Thank you so much. That was really excellent. That was a great overview of what our country offers in terms of training for ROP. And I totally agree with you that given this huge population and so many centers that we have across India, there are only 9 centers which can offer some amount of ROP training. So as you know, more and more people get trained into ROP, they can next become the trainers for the next, after say whatever 3 or 5 years of experience.
Definitely.
So upscaling those centers is really essential, given the fact that more and more newborn and preterm babies are going to land up surviving with better improvement of NICU facilities. So that should be definitely one thing which we can suggest to AIOS to take up.
Definitely, yes.
Yeah, it was very nice talk.